Good afternoon. My role as Medical Officer of Health is to protect the health of the public. The decisions I make are informed by the current scientific evidence, knowledge and experience we have gained since the pandemic began, consulting with trusted experts, and listening to your concerns. Mental health issues, domestic violence and neglect, negative effects of COVID-19 on addictions and overdoses, and economic hardship are causing much suffering. Please know that these concerns are also top of mind for me and the health unit as a whole when making public health decisions that affect all of us. The current threat we face is the most serious since the pandemic began. While the COVID-19 cases and numbers and deaths are decreasing throughout Ontario, variants of concern are on the increase and spreading rapidly. The burden of variant of concern or VOC cases are significantly greater in our health unit district and increasing. The following data is illustrative. Since the onset of the pandemic, Toronto Public Health has a confirmed or preliminary ratio of VOC to total cases that's equal to 0.37%, while our health unit district ratio of VOC to total cases is 9.3%. Between January 28th and February 18th, 68% of all of our district COVID-19 cases are VOC, either confirmed or directly associated with the VOC outbreak. This is significantly higher than the rest of the province. We also know that VOCs spread 50% to 70% more easily. There's an ongoing outbreak in a community apartment building, with many being older individuals. Sadly, there has been one death. The VOC has spread beyond the apartment building outbreak to 2 school cases, necessitating the closure of 2 schools. There is now community spread of VOC, meaning that a person has acquired the VOC and does not know where they got it from. No travel history, no contact with positive cases, and we're not in an outbreak setting. Both the Nipissing and Parry Sound districts have VOCs. The district of Parry Sound has 2 individuals who have preliminary positives for VOCs who don't know where they acquired the virus. We are still awaiting confirmation of the strain. The Nipissing district has an outbreak associated to VOCs, specifically the COVID-19 VOC originating from South Africa. And recently, an individual not associated with the outbreak tested positive for a COVID-19 with a preliminary positive of a VOC. Other reasons for this action is that due to vaccination shortages, only first doses have been given to all long-term care home residents, high-risk retirement home residents, elder care First Nation individuals, and staff. However, only a few healthcare workers in long-term care homes were vaccinated, so doses wouldn't be wasted. And a few alternate level of care hospitalized patients awaiting transfer to long-term care homes have been immunized. No hospital healthcare workers throughout the 4 hospitals in our district have been immunized, and they put their lives on the line every day to keep you and I well. Hospitals within our district have limited resources and surge capacity, especially if healthcare workers become ill with VOCs. Other vulnerable populations within the community have yet to be immunized. So what can we learn from the first and second wave that helps really to inform decision-making moving forward? Well, we know that public health measures can slow the spread of the virus, prevent everyone from becoming ill at the same time, and prevent our healthcare system from being overrun. However, these public health measures must begin early, they need to be strict, and must be followed. We have also learned that loosening restrictions increases social interaction and increases the risk of spread of the virus. For all these reasons, I have recommended to government to remain out of the response framework, similar to Toronto and Peel, and continue in shutdown with the stay-at-home order in place. Now is not the time to be opening up our district. We have a small window of opportunity to try to stop the spread of VOCs in our communities. If we do not continue to follow precautions and prevent a surge of COVID-19 variants of concern, more people will become ill and more people will die. More measures may then be required, such as a prolonged lockdown or school closures, which will have profoundly harmful effects on youth and people struggling with poor mental health, violence, or addictions. It is more important than ever that we follow public health measures, especially staying home, except for essential reasons. Physical distancing of at least 2 meters, wearing a face covering, washing and sanitizing your hands often, covering coughs and sneezes. And if you start experiencing symptoms of COVID-19, self-isolate immediately and arrange to be tested. Until vaccinations are completed, these are the only tools that we have to fight the virus and the VOCs. Now in January, I closed outdoor public skating rinks, skating trails, and tobogganing trails or hills due to the number of individuals who were gathering and using these locations without following public health measures. I also closed the OFSC snowmobile trails and snowmobile trails on Crown land in January. This was due to the number of individuals who were coming from out of district to use these trails. Many of these people were carpooling with individuals they did not live with. Individuals were gathering in parking lots and on trails and not following public health measures. I understand how frustrating these local closures have been, and I want to thank everyone who, despite not agreeing with them, still followed the closure rules. So after much consideration, I am opening up the outdoor public skating rinks, skating trails, and tobogganing hills as of February 22nd, with the requirement that municipalities monitor these sites to ensure that individuals are following public health measures, such as physical distancing, following gathering limits, and wearing a face covering. If we are made aware of public health measures not being followed, I will reevaluate the situation and potentially close these amenities again. I've also assessed the situation in regards to snowmobiling within our district. After careful consideration, I am reopening the OFSC snowmobile trails and snowmobile trails on Crown land as of February 22nd. I will also continue to monitor the situation, and should I have evidence of people not following public health measures, I will reevaluate the situation and potentially close these trails again. I believe that our district has done an excellent job of supporting each other, both through public health measures to keep each other safe and by supporting our local businesses. We've come so far, made many sacrifices, but we have to hang on a little longer. So let's continue these efforts by staying home, staying safe, and saving lives. Thank you.